This was a very intriguing trial where investigators from Europe, working together with a large number of individuals across the globe in pediatric bone marrow transplant, decided to test a standard, an age-old thing that we believed, whether total body irradiation was needed for bone marrow transplantation in children. There had been, prior to this study, one very teeny randomized trial that just didn't go anywhere, and no one believed it. There have been a few retrospective looks that all seem to indicate that total body irradiation was needed for children undergoing transplantation for ALL. But the hypothesis of these investigators was that with improved supportive care and selection of patients who had relatively, good disease control, perhaps total body irradiation wasn't needed. What they did was they compared very well accepted standard total body irradiation regimen. They compared two chemotherapy-based regimens, one busulfan-based and the other treosulfan-based. Um, this was a very ambitious study, very large study. They needed up to 1,000 patients to show equivalence of the non-TBI regimens with the TBI regimens. And the study went along until they screened just over 500 and randomized about just over 400 patients. And what happened was the study was closed early by the DSMC because it was very clear that TBI was superior. TBI led to better overall survival. TBI led to much better event-free survival. And the big reason for that was a marked increase in relapse in the non-TBI approach. So even though this study didn't accomplish what the investigators set out to do, which was to try to no longer use TBI in